Hi, I'm Jen Kraft. I'm a physical therapist at Therapedia in Lake Oswego. I'm here to talk to you today about the hip joint and pain in the hip and what we can do as physical therapists to help you with that pain. So the hip is an amazing weight-bearing joint, has a ton of range of motion and mobility so that we can run and hike and bike and just be really active outdoors. But with all of that mobility and range of motion comes a lack of stability. And so the muscles and ligaments around the hip joint tend to tighten up and can get imbalanced. Those imbalances in muscles can cause hip pain later on down the road. Hip pain can develop from overuse injury or a trauma. With overuse injury, often it's those imbalances in muscle length, tension, and strength that cause the injury and the pain later on down the road. So with runners, for example, if you are running with quad dominant mechanics, so you're running really strong from your thighs, but you're not really utilizing your glutes and your hamstrings, those posterior chain muscles, you're gonna get out of balance, and eventually your hip flexors can start to get tight. The glute weakness can cause pain in the back of the hips and the pelvis, and it carries on down the chain to the knees as well as up to the back. If your hip pain is affecting your general mobility, so how you're getting around and walking, how you're getting up from a chair, or how you're sleeping, you want to come in and see a physical therapist right away. Your PT can help pinpoint the exact cause of your pain through a PT examination and evaluation. During your PT eval, the physical therapist will talk to you about your symptoms, when they started, why they started, and just how they've evolved from the beginning to where you are today. From there, we'll do a test and measures, so doing an examination hands-on, looking for muscle imbalances in strength, flexibility, and joint mobility. So the joint itself can get tight in the hip, and the knee, and the spine. So we look at the whole patient, we look at the whole body and look for any discrepancies that could be causing that hip pain. Physical therapists are also trained in differential diagnosis with use of special tests. So we can put you through different tests and measures to help lead us towards a diagnosis.
You're going to start out lying on your side with the affected hip up towards the ceiling. You want your upper body to be stable and your legs are together with your feet touching. You're going to keep your core tight and lift the top knee up, rotating through the top hip. You should feel activation in the outside of your top hip, keeping your upper body stable, shoulders relaxed. Start out standing with both feet underneath your hips. You're going to cross the unaffected leg over the affected leg. So in this case, we are stretching out the left IT band. You're going to lean away from that side, and you should feel a stretch on the outside of your hip, potentially all the way down to the knee.